Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. Let's just continue and begin our last lecture of the success course of the UKMLA 2 exam. The topic that we are going to discuss today is going to be prescriptions. Okay, so prescription station is something that would definitely show up in the exam, and there wouldn't be a day on which GMC would not be testing a prescription station. Okay, so you need to make sure that you are well versed with it and you're very well practiced the prescription stations. Another important thing before I move on is that there are 35 different prescriptions cases that you need to see, that you need to check, and that you need to practice. Okay, and in this particular lecture I'm not going to cover all those 35 cases differently and separately, but what I'm going to do is that I'm going to cover you the basics for the prescription, that what are the do's and the don'ts, and what are the things that you need to take care of while you are practicing, and while you are writing down a prescription. Because by the looks of it, it just seems very easy that okay, there is a case note that is given and you just need to like copy and paste the drugs and the durations and other medications, and that's it. But it's not that easy. It's not as simple as it looks. It is indeed very complicated. There are a lot of things that you need to take care of, and just because we don't take these basics seriously, we don't take these obvious things, or the things that goes without saying, like we very seriously. And that is the reason why prescription is the most commonly failed station. It is the most commonly failed station. And I've taught like more than hundreds of people, and I've seen more than hundreds of different results. And what I have seen is that the students who are failing the prescription stations, they are also failing the overall exam as well. Okay, so make sure that the prescription stations is covered, because it is something, if you master it, it's a short station and you can clear it very easily. Okay, number one. Number two, you need to make sure that you are not leaving any margin of error, because over here it's a all or none rule, and the margin of error is like really low. If you end up making one mistake in the prescription station, then there is a very strong chance that you may just fail the station, and that is what I have seen. I have not seen a lot of people getting getting failed on 4 or 5 on 12. Okay, they fail very badly, either on 0 or 1 on 3, or they score very high in the prescription station, like 8, 9, 10, and 11. Okay, I've even seen one of the candidates scoring 12 on a prescription station as well. Okay, so it's an all or none rule that I've noted, and in the results pattern. So make sure that you have covered each and everything well, and you have sorted it out, and make sure that you have practiced the reception session not just once, not twice, but at least thrice. Okay, like there are 35 sessions, different topics. So if you practice all of them 3 times, that means you should have written at least 100 prescriptions before your PLAB 2 exam. Okay, and that is how important it is, and that is what the importance of this particular type of prescription station is. Okay, so now let's just move on to the basics, that what are the things that you should be aware of, so that once you're practicing, and once you're writing those prescriptions down in your practice sessions, you know what to do and you know how to go about it. All right, so let me just give you an overview of the general settings that you would have in a prescription station. Okay, once you enter inside the room, there may be a simulator, there may not be a, sorry, there may be an examiner, or there may not be an examiner that would be sitting there. But what would definitely be there would be a desk on which there would be 3 baskets that would be present. Okay, in basket number 1, there would be a prescription paper. Okay, there can be syringe driver chart. Okay, what are the syringe driver chart? I'll just going to share with you, and I'm going to give you an idea that what the syringe driver chart is. Then there's going to be a fluid chart as well. Okay, in which you have to prescribe IV fluids. Okay, so that is what the thing would be there in the basket number 1. Okay, then in the basket number 2, there would be a sticker for patient information. Okay, and there would be multiple pens that would be placed. Okay, there would be a blue pen, there would be a black pen, there would be a red pen, and there may be a green pen as well. Okay, so different colored pens would be present in that particular basket along with the sticker for patient information. Then in the third basket, you would have something called the BNF. Okay, that is the British National Formulary. It's basically a bible for all the medication, for all the drugs, and for all the pharmaceutical things that are used in the NHS. Okay, this is called the BNF. Okay, the BNF book. We've got two different BNF, one for the adult and one for the pediatric drugs. Okay, so it contains each and everything: the drug, the doses, the frequency, the indication, the contraindication, the drug interactions, and like it's basically the bible of prescriptions that is used by the doctors in the NHS. Okay, so you will have the BNF and an examiner that's in the front. Okay, there may be an examiner desk, or they may just be monitoring you through a camera. Okay, so you need to keep that in mind. Now let me just familiarize you with the prescription paper. Okay, as you can see on the screen, this is how the prescription paper would look, and this is the first two sides of the prescription paper. At the very top, you need to write the details, the name of the consultant, the date of the admission, okay, the weight, height, and then on the very next side of it, you need to place a sticker. Okay, this is the place where you are going to place a sticker which would contain patient information. Okay, and that sticker would be provided to you in basket number 2. Okay, and then they ask if the VT risk has been calculated, and if the VT assessment has been done. And then there is a section to ask about the known allergies to a particular drug, and what kind of allergic reaction did that allergy cause. And then there is a list for the once only medication that you just give on stat basis. Okay, like for example, doxycycline, it is usually given on stat basis in cases of cholera and in cases of other diseases as well. Then you may just give some stat doses preoperatively, like preoperative antibiotics. You just give it once only. Okay, so these are the medication that are mentioned in the once only part. And then comes the oxygen, that uh, like what is the oxygen requirement, how it needs to be given, what is the target oxygen saturation. Okay, all of that you need to write, and at the same time you need to write the time and the date as well, and the frequency by which you have to give the drugs. Then the next page is the antibiotic sections. Okay, in this you just talk about the antibiotics. You add the name of the drug, the indication, the dose. Okay, and the start date and the end date, and then you over on this column you write the frequency and the time on which you have to give the drug, and then any specific additional information that you may want to uh, like prescribe for a particular antibiotic. Okay, so this particular page is just for the antibiotics, so all the antibiotics would go over here. Okay, those antibiotics which are given continuously, and those antibiotics which are given on continuous basis. Okay, uh, then this particular page, as you can see, this is again the top section is the same, the details of the patient, the hospital, the consultant name. Okay, and the same sticker would go over here as well. And this page is for the as required, or sorry, basically the regular medication. Okay, like for example, somebody might be a hypertensive and they might be taking antihypertensives on regular basis. Okay, so this is something that would come over here. Somebody may have bipolar disorder and they may be taking lithium continuously. Okay, so this might come over here. And there are some cases in which you have to prescribe a medication for longer duration, like for example 3 months, 6 months. Okay, like for example, the case of pulmonary embolism, in which you have to prescribe apixaban and rivaroxaban for long period of time. So all of that would come in the regular section. Okay, and then on the next page, we have got the as required sections. Okay, and what is the as required? Like for example, some drugs which are as required, like for example the painkiller medications. Okay, they are not taken continuously. Whenever the pain is, it is given on the SOS basis. Then comes the inhalers as well. Like for example, if somebody is having an asthma, you're going to give him the inhaler, and it is not something that you may prescribe on continuous or regular basis. Okay, you may just prescribe the inhalers on as required, or per needed basis. Okay, So you're just going to mention those PRN drugs over here in this section. Okay. So yeah, this is what the basics, and this is how the basic prescription paper would look like, and these are like the 4 to 5 different sides of the prescription paper that are there. Okay. Then there is something called the syringe driver chart. Okay, syringe driver chart is basically this is usually given in the palliative care stations, and so what they do basically is that in the palliative care patient, you would have to calculate the breakthrough doses, and you would have to see that how on what dose is the pain getting settled. And we have learned this concept in lab 1 as well. In the palliative care, we calculate the breakthrough doses, and we did use the syringe driver calculation as well in the lab 1. So you need to just apply the same calculation in the lab 2 as well, and then you need to write the driver doses over here on this paper, as well as in the main prescription paper as well. So you need to be familiar with the syringe driver paper as well. Okay. Then there's a very strong possibility that you would have to prescribe the fluid for dehydrated patients. Okay, and you would have to do the hydration in adults as well, in the children as well. Okay, so you're going to get the fluid chart in both the children and the adults. Okay, so you should be familiar with both of them. The fluid chart that is used in the children, this is how it looks. Okay, you need to do the calculation over here on this side, and then you have to do the like write the name of the fluid, and the additive that you need to give, and the rate at which you need to give that particular fluid, and how much fluid you need to give. All of it needs to be written over here. And in the adults, you would have to do the same similar way, not the same way, but this is how the adult chart would look like. Okay, so you should be familiar with the fluid chart as well, because there are two peds prescription and one adult prescription in which you have to prescribe the fluids. Okay, so yeah, that is how the prescription papers are going to look. Okay, and I hope that you are familiar with it, and whenever you practice, it doesn't come to you as a surprise. Now what I'm going to talk about is the basics, and is the general advices that are like really really important. Okay, now let me tell you that as I mentioned, there's a very low margin of error in the prescription stations. Okay, so you need to make sure that you follow these general rules very properly, and you're not missing out on any particular rule. Okay, and now I'm going to tell you very important and golden rules that needs to be followed. Okay, number one, as I mentioned, that there would be a different colored pens that would be uh, present in the basket. Okay, so you make sure that you use the black pen only. Okay, if you write a flawless prescription using a red pen or a blue pen, I'm sorry my friend, you're not going to pass the station. Okay, it needs to be written in the black pen only. Okay, because there are multiple pens over there, you are so much in stress, you have got anxiety. Okay, and then you just end up taking any colored pen, and then you just start writing the prescription. Okay, so it needs to be written with the black pen only. So make sure that you pick up the black pen and then write the prescription in black pen. Any other color, you're gonna fail the station. Number one. Number two, all medication should be written in block capital letter. Okay, another common mistake that people do, they don't write it in block letter. Okay, so even if you're prescribing morphine correctly, but you haven't written morphine in block letter, okay, you're going to fail the station. Okay, and as you can see, the picture that I've attached, you can see that morphine is written in block letters. Okay, very important. Number three, you need to mention your full name and the GMC number on the very top of the paper. Okay, always remember that whatever paper you have, whether it's the syringe driver sheet or whether it's the main prescription paper, your name and GMC number needs to be written over here. Okay, I'll just show it over here as well, of where exactly you need to. So this is the location. Okay, this is the point where you need to write your full GMC number and your full name. Okay, and if you don't do that, okay, even if you have greeted the examiner and told the examiner your GMC number, if your GMC number and your name is not on the top of the prescription paper, your station would fail. Okay, it would fail. There is no chance that you're going to pass the station. You may be just lucky. Okay, they may just ignore it, but it's a pretty big red flag, like missing out on your GMC number and your name at the very top. So you need to make sure that you're always written it, and I cannot emphasize it anymore. Okay. Then this particular section in which you have to write the ward name and the consultant name, the hospital name, date of admission. Okay, all of it, all of these details would be provided in the case notes. Okay, and I'll just show you one case note. Yeah. Okay, so this is how the case note would present to you. Okay, and all of these details would be mentioned in the case notes. Okay, so make sure that you've copied it down. Make sure that you have mentioned about the all the details. What mistake people make over here is about the weight and the height. Okay, you can see these two sections, the weight and the height. There is a very strong chance that the weight and the height is not mentioned properly. Okay, and there is a very strong chance that it may not be mentioned at all. Okay, so in the case if it is not mentioned, then do not leave it blank. Just put a dash, or just put a like a dash, basically, to make sure that you've acknowledged the fact that you needed to write the weight and the height, but it's not given in the case notes. So you're not leaving it blank, and you're just putting a slight mark on it. Okay, to make sure that nothing of this goes empty. Okay, nothing of it goes empty apart from the date rewritten. Okay, there is only one prescription session in which you have to rewrite the date. Okay, and you're going to find out when when you're going to prepare and we're going to practice the prescription session. Only in that particular session you would have to write the date rewritten. Other than that, there is this section particularly mostly goes empty. All right. Then, very important thing, patient sticker. Okay, on the identification page needs to be there. Like for example, I just showed you that this is the area where you have to attach the sticker. Okay, on this page and on the front page as well. Okay, so you would be provided with some stickers in which there would be patient details that would be mentioned. But there is a trick and there is a catch over here. um, in order to confuse you, in order to make things difficult for you, what the GMC may do is that they may just add like more stickers and of different names as well. Okay, just to confuse you, and because you're in your exam stress, because you are very anxious because of the exam, you may just pick up another sticker of a different name and just paste it. Okay, make sure that you are reading the case notes properly. Okay, like for example, in this case the patient is Mrs. Victoria Yates. Okay, aged 80. Okay, so make sure that you pick up the sticker of Miss Victoria Yates only. Don't pick up the sticker of Adam Smith. Okay, and there is a very strong possibility they may have just put multiple stickers in the basket. Okay, so you need to very carefully see that okay, the sticker that you are picking up is of the same patient. The name is same of the patient that you are prescribing for. Okay, and do not just add a sticker of a different name to it. uh, and this is not just to confuse you, or not just to make things difficult for you. When you work in the NHS, you would realize that a lot of stickers are present, okay, of all the patients who are admitted in the ward. And all the labeling needs to be done with the sticker, whether it's the blood samples that are being labeled, or whether it's the belonging that are being labeled, or it's the prescription that is being labeled. Okay, so you would find multiple stickers over there in the ward as well when you work in the NHS. So sorry about that. Yeah, so this is what they're trying to see, and this is what they're trying to assess, that whether or not you are vigilant enough, whether or not you are concentrating enough on the fact that okay, you need to pick up the right sticker. Because if you don't have the habit of doing it right now, when you enter into the NHS, when you start working in the NHS, there is a very strong possibility that you may make this error, and you may make this mistake of labeling the sample or labeling the prescription incorrectly. Okay, so the sticker thing is also like really, really important. Wrong sticker, station gone. Okay, then they ask about the allergies. Okay, if there is an allergy, just write the drug and the kind of reaction that happens because of that particular drug, or that kind of reaction that happens. Okay, and this is something that would be mentioned in the case notes. In case there is no allergies, okay, then just write NKA. That means no known allergies. Okay, do not leave it empty. Okay, NKA and a dash over here. Okay, do not make the mistake of leaving it empty. No allergies, write NKA. Okay, then there would be few boxes that you would have to take. Like for example, in the VTE assessment, there are a few cases in which you need to talk about the VTE profile access. So you need to make sure that you tick the boxes in the case of VT risk assessment forms. Other than that, there would be certain cases in which you would have to prescribe for a patient of MRSA. Okay, and there is a box for the MRSA as well. I'll just show it to you. It was here on the first page. Yeah, so you can see, please take if the patient has any of the following: colostrum difficile, MRSA, or MSSA. Okay, so if there is the patient is having MRSA, then you need to take for the MRSA as well. Okay, along with the VT prophylaxis if the patient is uh, here to get prescribed VT prophylaxis. Okay, so you need to see in what are the session in which you have to take the VT assessment, and what are the session you have to take the Masra box. Okay, so this is like really really important. Then now let's come to actual prescribing. Okay, what are the things that you need to take care, and what are the things that you need to have in your mind when you're writing down the drugs? Number one, the doses needs to be written very clearly. Okay, and there is no abbreviation for microgram. Okay, you cannot write mcg in microgram. Okay, the microgram needs to be written as microgram, like you can see over here, 400 micrograms. Okay, yeah, milligram can be written as mg. Okay, you can see that milligram is written in mg, like in the clarithromycin. Okay, so milligram can be written as mg, milliliter can be written as ml. Okay, but microgram needs to be written as microgram, microgram. Okay, really important thing. A lot of people end up making this mistake that they write 400 mcg and then they just assume that okay, that is fine, but you're not supposed to do that. Okay, microgram needs to be written as microgram. Okay, really really important pointer that you need to have in your mind. Other than that, do not use any other abbreviation other than the approved one. Okay, and just going to share with you what are the approved one. Like you can see that you need to mention the route. Okay, like the subcutaneous is mentioned over here, per oral is mentioned over here in the antibiotic sections. Okay, so you would have to mention the route of the particular drug. Okay, so make sure that you use this list that is provided over here, like IV for intravenous, SC for subcutaneous, IM for intramuscular. These three are like commonly used abbreviation. It's unlikely that you're going to make them wrong. But for the nebulizers, you need to give NEB. Okay, this is something new. Per oral is PO, we know that. Topical is TOP. Okay, that is something new. Per vaginal is PV, we know that thing. Inhalation is INH. Okay, that is something new that you may have not come across. And per rectal is PR. We know this thing as well, that per rectal route is written as PR. Okay, so always make sure that you have only using these approved abbreviation. Okay, and not any other abbreviation. Like for example, in the inhalation people write intranasal, IN. Okay, there is no such thing as intranasal, it's inhalational, that is INH. Okay, so very small things but do have a very 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 important and a very significant impact. Okay, then what you need to do is that you need to make sure that you write your name and your sign along with your GMC number and a bleep number. Okay, so you can see over here that there is a bleep number that is written 1234. Okay, so there will always be a bleep number given to you in your case notes. Okay, so always make sure that whenever you're reading the case notes, you check that okay, do you have a bleep number or not. Let me just uh, show you one prescription in which I had a detailed, case note available, in which everything was written, the bleep and all. Mm, right now, I'm not able to find it, but I'll try to attach it in the comment box. But usually, it's everything is written, and everything is like written in a lot of detail. The bleep number is also mentioned, so you need to see that you are mentioning down your bleep number as well. Okay, do not miss on the bleep, because if you miss out on the bleep, unfortunately you're not going to clear the station because there is no margin of error. Okay, then there are a few cases in which you would have to prescribe oxygen. Okay, and this is the way to prescribe oxygen. Make sure that you target the oxygen saturation. Okay, whatever your target is. For a normal patient, it is going to be 94 to 98%. For a COPD, it is going to be 88 to 92%. Then write the device, the flow rate, and circle the information whether you wanted PRN. PRN is basically per need and or continuous. Okay, so you can see that you've targeted, you've circled these target saturation, you have circled whether it's PRN or continuous, you have used the devices, you have talked about the rate, that is 1 to 2 liter per minute. Okay, and then you have circled the entire thing because you want it every single day, like continuously, Monday, sorry, morning, evening, afternoon, and night. Okay, so make sure that you have covered all of these things in this particular way, because there is a lot of things that like very very minor things, 1 2 3 4 5 6 7 to 8 things to just do in this particular section, and if you miss out on any one of them, your marks are going to be penalized. Okay, and you don't want that to happen. So make sure that whenever you're prescribing oxygen, you are prescribing it completely. And why am I emphasizing it so much on this? Because this is there's only one prescription out of the 30-35 prescriptions in which you have to prescribe oxygen. Okay, and that is the reason why we don't get to usually practice it, and that is the reason why we end up missing out on something or the other from this section. Okay, so please make sure that you are filling it with open eyes and open brain. Okay, you're not supposed to miss out on anything. You miss out on one thing and then that is gone. Like you can see in this particular example picture that I have attached, they have not written the date over here. Okay, just a very small thing, the date is missing. Okay, like even though it was a like a sample prescription, but I missed out the date over here. Okay, so you see, even even if you're teaching something, even if you're practicing it multiple times, still you're going to miss out on something or the other. Okay, I've mentioned the date over here in the next picture, but I've mentioned the date, I forgot the date over here. Okay, so this is what I'm trying to teach, like you are going to forget things. Okay, and but you need to make sure that you are doing it completely right, you're doing it perfectly. Okay, you're not supposed to miss out on the date, because in this case the date is missing over here. I would have failed the station, like maybe failed the station, or maybe a lot of my marks have been like would have been penalized on this. Okay, so each and everything is important, even the minute details are like really, really important. Okay, then when it comes to prescribing antibiotics, another very important thing is that if you're prescribing IV antibiotics, then you need to mention that the IV antibiotics needs to be switched to oral as soon as possible. As you can see that it is written over here that switch IV to per oral ASAP. Okay, really, really important. Then a lot of people, what they miss out on is the frequency and the time. Okay, for the antibiotics, you cannot write OD, BD, TDS or QDS. Okay, you need to mention the time. Okay, like for example, if you're giving a medication QDS, that means 4 times daily, then this is the time that you need to write: 6, 12, 18, and 00. Okay, if you're given a medication on TDS basis, then you need to write it 8, 20, sorry, on the TDS basis, 8, 16, and then 00. Okay, at 8-hour differences. Okay, in the 24-hour format, the time needs to be written in the 24-hour format. Do not write 6 a.m., 6 p.m. Okay, do not take that approach. Okay, it's the incorrect approach. The time needs to be mentioned in the 24-hour format, and like the way it is shown over here, and make sure that you are mentioning the dates as well, because you see there is a lot of information. It's a small box, but there is so much information. You need to take care of the dose, you need to take care of the abbreviation, you need to make sure that you are writing it in block letters. You need to make sure that you've written down the time, you've written down the date, then you've used the correct route, correct start date, correct end date, you have mentioned your GMC number, you have mentioned your bleep number as well, and then you have written your name and signed it over here. You have mentioned the indication, and then you have mentioned to switch to oral as soon as possible if you're prescribing an IV antibiotic. Okay, all of these things are like really, really important, and there's a lot to do. Another very important thing, when you're prescribing the antibiotics, you're going to find these two boxes: sensitivity and micro approved. Okay, just put a dash on both of these things. This is something that is not your concern. Okay, and you don't need to worry about it a lot. Okay, just put a dash on it for the exam purpose. Okay, like you can see in this as well, it's completely empty, but don't leave it empty. Okay, it's always advisable to leave a dash. Okay, and then in the antibiotic, as I mentioned, you need to mention the time, but in the regular medication, okay, you don't need to mention the time, but you need to tick the specific time. Okay, like for example, morning, afternoon, evening, night. Okay, you need to take it. Like for example, if somebody is taking prednisolone, okay, and it is prescribed in the morning, so you just take it in the morning. Okay, and let's say that if you want to prescribe a regular medication for just 5 days. Okay, so what you're going to do is that you're going to leave 5 boxes and then put a dash or put a slash on the other day so that it doesn't get continued. Okay, like for example, you can see in this regular medication section that ipratropium bromide has been started on the 1st of January. Okay, fine, and there is no particular stop date right now, so there is no slashes or there is no crossing that is done on these boxes, because this is something that needs to be continued. But the prednisolone, as you can see, it is prescribed for 5 days. Okay, so that's why 1, 2, 3, 4 and 5 boxes are left and the other boxes are slashed out. Okay, that means that these are the medication that this is the medication that needs to be given for 5 days only, and the other time needs to be stopped. Okay, so you need to make sure that apart from mentioning the stop date correctly, you also cross out on the extra boxes. Okay, you don't leave a margin for error. This is something that is going to take your prescription level to a higher level. Okay, that you're being extremely safe and mentioning the stop date and also crossing out on the other boxes, so that the nurses who sees the order and nurses who are administering the medication, they are well aware of the fact that okay, it needs not to be given more than 5 days. Okay, really, really important. Other than that, in the as required section, okay, you would not have a date and specific time that you need to take, but you would just have to mention the frequency. Okay, and as you can see that over here, it's the frequency that is mentioned. So in the as required section, do not mention BD, TDS, OD, QDS. Okay, it is as required. Okay, and you just need to say that okay, at how many hours it can be repeated. Like for example, we know that the paracetamol needs to be repeated in 8 hours. Okay, and it can be only given TDS. Okay, so now I'm not going to write TDS, I'm going to write 8 hourly. Okay, similarly, as you can see in the salbutamol that is mentioned over here, it is given 6 hourly. Okay, so in the as required section, you need to write the hours. Okay, at which it needs to be repeated. Okay, 8 hourly, 6 hourly, and it would be written in the case notes. Okay, that on how many hours and on how much time duration can a particular medication be repeated. Okay, so yeah, these were the important do's and don'ts, and these are the important tips and tricks of the prescription station. Okay, but now let's just move on to a very, very important thing. And this is the question that I am like very, very frequently asked, that what is the interpersonal skills in the prescription station. Okay, and because there is a not there isn't a lot of talking involved, and like how are you going to like make sure that you are displaying a very, very good interpersonal skills. Okay, so there are a few things that you need to make sure to score high in your IPS. Okay, and what exactly is the IPS in the prescription, I'm going to tell you right now. It begins right from the moment you enter inside the room. Okay, and the more energetically you enter inside the room, and the more happy way you greet the examiner, okay, you're going to automatically get a mark for your IPS. Okay, be energetic, that hello examiner, I'm Dr. Saroj Siddiqui, my GMC number is this. May I please proceed with the station? Okay, that is one important point of the IPS. Okay, number one. Number two, you need to show that you are disciplined. Okay, if you're using the BNF at the end of the station, make sure that you close the BNF and keep it back in the basket it was present initially. Okay, number one. Number two, you need to make sure that you close the pen as well. Okay, a lot of people, what they do is that they use the pen and they just leave the lid of the pen open, like this. Okay, and they just drop the pen. Okay, close it properly and then keep it wherever it was placed initially. Okay, you need to show that you are disciplined enough. Don't just leave the book open. Okay, BNF just open and like lying down on the table. Close the BNF and place it in the same basket that it was placed before. Okay, really important. Number two. Number three, you need to thank the examiner after the session. After you're done with the session, don't just hand over the prescription paper to him and just go away. Just be like, thank you examiner. Okay, all of these things, they're like very, very important and very, very minor things, but they have a very huge impact on your IPS skills. Okay, you need to thank the examiner for patiently observing you and patiently looking at you and judging you. Okay, So this is what you need to do, like from your body language, from the way you talk, from the way you enter, okay, and how you act. When it comes to the prescription paper, what you need to do is that you need to have a very clear and legible handwriting. A lot of tutors and a lot of academy, they say that the handwriting doesn't matter. No, I'm really sorry to say that, but the handwriting does matter a lot. Okay, your handwriting needs to be like really really good. You cannot just scribble. Okay, like for example, I mentioned in the next point as well, you cannot just do scribbling. You cannot just cut one thing and write one thing again. You cannot have a confusing handwriting, overlapping handwriting. Make sure that you are doing a spaced out and a very legible and a very clean handwriting. Your prescription paper should look really really clean. Okay, and if you're not doing that, you're going to compromise on your IPS skills as well, number one. And the examiner may not understand what you've written, so your management pointers will also go. Okay, so make sure that you are writing it properly, no scribbling, no cutting, okay, and no slashing of the medication. If something has gone wrong, that is fine. Just put a very decent and a very simple cross on it, and then just move on to the next section to write it clearly. Do not overwrite. Okay, these are the things that you need to have in your mind when you're dealing with the prescription station. Okay, and one very important thing that nobody is going to tell you, you need to keep on verbalizing whatever you are doing. Okay, even if the examiner is not talking to you. Okay, and this is something that someone would really really do. Okay, it is always advisable to keep on verbalizing what you are doing. Okay, it will help you increase your IPS skills. Okay, and this is something that I have personally noted. I cleared my lab 2 exam in 2 attempts. Okay, in my first attempt I did not do this. In my second attempt I did this, and I scored a 10 on 12 in my prescriptions. Okay, so you need to make sure that you are doing it. Like for example, if you are mentioning about the allergies, and if you are about to write about the allergies, you can just verbalize it that, okay, I can see that my patient is allergic to penicillin and he developed a rash, so let me just write it down for you. The patient has allergy to penicillin. Okay, and then if you are dealing with the clarithromycin patient who is on statins as well, and you are stopping the statin. Okay, so you're doing all of those things in the prescription paper. You are stopping statin because clarithromycin and statin interact with each other. So just verbalize it. Okay, okay, I can see that this my patient is taking statins as well, so I cannot prescribing clarithromycin along with statin, so let me just stop the statin for 5 days. Okay, verbalize what you are saying. Okay, and this is something that would that should help you in your IPS. This is something that I tried. Okay, and it worked for me. Okay, and there is a very strong possibility that, okay, if the examiner doesn't want to listen, they're just going to politely request you that no need to verbalize it, just write the prescriptions. Okay, but if they don't, then you can just keep on verbalizing it. There is no harm in verbalizing whatever you are writing it down. Okay, unless the examiner stops you to. Okay, so make sure that you have this thing in mind. So now you see there are so many things in the IPS, like one, two, three, four, five different things in the IPS, and you're getting 4 marks for it. Okay, so there is certain degree of IPS in the prescription. Okay, do not think that IPS there is no IPS in the prescription. They're just going to give you 4 marks just for showing up. Okay, that's not the case. You need to do all of these things in order to make sure that you're scoring good in your IPS skills as well in the prescription, because these are like very basic things. Okay, and you do not need to worry a lot about it if you're just able to like follow these guidance and follow these advices. You would be scoring a 4 on your IPS or a 3 on your IPS automatically, and then you would just need 3 marks more to clear the prescription station. Okay, which you can very easily achieve like by writing the drugs in the way that I have taught you. So this is something that is going to make your life so much easy. Okay, then now let's just come to the last section, that is the BNF. Okay, the BNF is a book that is given to you. It's the Bible of the drugs and the medications that are used in the NHS by the doctors. Okay, and you have to use the BNF. Okay, you have to use the BNF. And what they advise you is that, and what they instruct you is that you use the BNF in every cases. Okay, but that is not true. What I would recommend is that, number one, remember all the doses of the prescriptions. Okay, and do not rely on the BNF. Why? Because you've got 7 minutes to write the prescription. You've got 7 minutes to complete the prescription, and you cannot just open the BNF for each and every drug that you've been asked to prescribe. As you can see in the case notes, like there are multiple drugs like 1 2 3 4 5 6, okay, and you cannot open the BNF for each and everything. Okay, so it is recommended that you remember all the doses, and then just write it down and write the doses as per your memory. Okay, however, you would have to open the BNF for a couple of drugs to just to show that you are a safe doctor. Okay, and you have the concept of referring to the BNF. Okay, that is why the BNF is important. So what I would advise you is to make sure that you've practiced your prescription sessions in a way that you are completing it in 6 minute time. Okay, and in the last minute, or in a 7 minute time basically, and the last minute what you do is that you just open the BNF and then cross confirm what you have written. That, okay, for example, you've written clarithromycin, let me just check the dose of clarithromycin. Yes, clarithromycin is given 500 mg BD, that means twice daily, and okay, that is fine. Let me now just open to salbutamol, and let me see that how I need to prescribe salbutamol. Okay, it is 400 microgram, and it is given 1 to 2 puff daily as per needed, and at a duration of 6 hourly. All right, that is fine. This is what you need to do. Okay, at the very end, okay, leave yourself 2 minutes to just review the prescription. Okay, and open the BNF, and just go to the drug that is mentioned, just to give the impression that, number one, you are a safe doctor. Okay, you want to cross check what you have prescribed, number one, and you have the concept of referring to the BNF, the concept that is there in the UK doctors and then the UK consultants. Okay, um, another important thing, a lot of people ask me that, doctor, the BNF is this thick, and how do we remember the page numbers, and should we remember the page on which a particular drug is mentioned in the BNF? Don't do that. Keep your life very, very simple. Okay, just go to the very end of the page. There is a glossary that is mentioned. Just locate the drug name over there, and you're going to find the page number. Just open that particular page number, and you would know that, okay, you are on the page where the BNF is talking about clarithromycin. You are on the page where the BNF is talking about vancomycin, or you're on the page where the BNF is talking about lithium or prednisolone. Okay, so just use the glossary. That is going to save up a lot of your time. Okay, do not remember the page numbers, and do not refer to the index, because in the index you wouldn't find a specific drug name. Okay, they have just mentioned the classes of drug, that are antibiotics or steroids, okay, or painkillers, and then you would have to open the chapter and then eventually go and find the drug. That is going to take a lot of time. Use the glossary at the end. Okay, and then just directly land to the page number on which you're talking about that particular drug, and just see and just cross check your prescription, and just act as if that you're cross checking it. But at the back of the mind, you should be aware of all the doses, and you should remember all the doses by heart. Okay, so yeah, that is what the IPS, and that is what the management and your data gathering was in the prescription station. Your data gathering was using the case notes. Okay, using the right pen, using the right paper. Okay, and your management was the way that you write these particular medications, write it in the right way, right route, right frequency, and another point of data gathering was using the stickers correctly. Okay, so all of these things, it's a holistic approach that you need to take in your prescription session, sorry for the slip of the tongue. um, and focus on your IPS. Okay, this is something that should be your take home message. Okay, so that is pretty much it from my side regarding the prescription stations, the basics of the prescriptions. Make sure that you have practiced it like at least thrice. Okay, at least thrice. The more you do, the better it is. And whenever you're going to the UK for your exam and to join an academy or something, make sure that you have printed these prescription papers and fluid charts from your home country. Okay, because photocopy and the Xerox copy in the UK is like really, really expensive. Okay, and the academies don't provide you with a lot of prescription paper. They're just going to provide you with 4 to 5 prescription papers. Okay, so make sure that when you're going to the UK, you've already printed 100 copies of it. Okay, and 10 to 15 copies of the fluid and the cylinder driver chart, because there are not a lot of prescriptions in which you have to prescribe the cylinder driver and the fluids. But the main prescription paper, at least 100 pages of or 100 sets of it. Okay, you've got it done from your home country, or from a friend, because this is something that can cost you a lot in the UK, because Xerox copy is actually like really expensive. So please make sure that you're carrying it, and make sure that you have practiced it at least thrice. um, ideally you should do it 5 times, but at least twice every prescription, so that you don't miss out on the important pointers, and you are able to clear the prescription session in the future, inshallah. That's pretty much it from my side. If you got any questions and any queries, drop them down in the comment box below, or drop them down on my socials, and I'm going to address all your concerns that you have. And if you want the personalized mock, or one-on-one mock, you can scan the QR code for more detail. Other than that, what you can do is that you can send your prescriptions to us, and I can, not promising it, but I'll try my best to review the prescriptions for free. Okay, so if you've got any questions, any queries, there is a contact number that is mentioned over here. Okay, just drop it down on the WhatsApp, and what I can do is that I can provide the feedback for your prescription sessions completely free of cost. Okay, but not promising it. It depends on my workload. It depends on the mock schedule. My mocks, my week is usually packed with the mock schedule. So I would have to see that as well. Then I'm working as well in a clinical role. So there's a lot of things that I need to manage. So I'm not promising it, but I'll try my best to provide you with the feedback, and provide you with your with the the corrections that you need to do in your prescription. So I would love to do that. Okay, so that's pretty much it from my side, and see you guys in the upcoming mocks, because this is the last lecture of the today, of the success course of the UKMLA 2 exam. So I'm hoping to see you on a one-on-one mock with me for your PLAB 2 exam. So that's pretty much it, and I wish you all a very good luck for your exam. Go ace it, and I'm sure that you're going to pass with flying colors. Allah Hafiz.